Welcome back to the training, What is Drug Addiction Counseling? This is the second lesson in the training, the basic concepts of drug addiction counseling. At the end of this unit, it is my hope that you're going to learn how to explain the definition of drug addiction counseling, explain the role of drug addiction counseling, and how to encourage and motivate your clients to reduce their drug use related risks, and also how to support those clients to seek care and support. I hope you'll learn to list 4 general principles for effective communication and also to explain the differences between empathy and sympathy. So we already discussed counseling in general terms. Now we're going to discuss drug addiction counseling. Remember that not everyone who uses drugs is addicted to drugs. So think about it for a few minutes. Can you tell me why drug users come to a counselor? There's no right or wrong answer here. I just want you to understand the rationale of drug counseling. It's going to include encouraging and motivating clients to reduce their drug use, any related risks, and also supporting them to seek care and support. So I'd like for you to answer that in the discussion section. Why do drug users come to a counselor? So addiction to drugs is going to be really difficult to overcome for a lot of people. Drug addiction counseling provides guidance on strategies to assist clients to reduce risks that are associated with using drugs and, if it's desired, to abstain from drug use. And counseling can be effective in reducing both drug use and harm associated with that drug use. Drug addiction counseling is going to enable the client to link the problems that they have to their drug use and then to identify any tangible solutions. Many of the skills and the techniques that will be taught in this course are based on cognitive behavioral frameworks that have been shown to be effective in assisting drug users to stop using drugs. So, what is drug addiction counseling? Counseling is a purposeful act of providing professional guidance. It's going to utilize various psychological methods and techniques to guide the client in a constructive direction. So, as I discussed before, intervention, drug addiction counseling is an intervention. And when you provide guidance or assist someone to make a decision, you are intervening in order to help that person to achieve a desired outcome. And the phrase there to explore his or her drug use confidentially. This is going to be important because the drug use and the misuse is illegal, and people don't want to be identified as users. And although users may come to a counselor in order to discuss their problems, most want to be sure that everything is going to be kept confidential. Remember that drug use is a sensitive issue, and breaking this confidentiality could cause some serious problems. And the last part of the definition, to discuss options about available treatments most appropriate to his or her circumstances, is going to indicate the expected goal and the objectives of the counseling session. So, in order to be effective, drug addiction counseling has to be client centered and based on that client's individual needs. The goals and the objectives of counseling should be negotiated between both the client and the counselor. And ultimately, the client should feel empowered to solve their problems on their own. The counselor is going to assist the client to understand the available treatment options and then to make any informed decisions on how best to proceed. So, I just want to emphasize the role that drug addiction counseling plays in assisting clients to reduce their risk or abstain from drug use. The role of drug addiction counseling is to help our clients to reduce their risk or stop their drug use, help them to set goals and develop plans, develop problem solving and refusal skills, identify any risky situations, and identify the ways to deal with that risk. Drug addiction counselors provide guidance and uh, advice to assist the clients to realize their goals through the development of specific skills and techniques. Informal communication in counseling sessions is going to help to enable that client to acquire these skills. So now we're going to discuss these communication attributes in greater detail. Effective communication really is an essential component of drug addiction counseling. Information exchange is greatly enhanced when the counselors adhere to a few basic principles to build that rapport and a sense of trust between the client and the counselor. We've also discussed the principles of voluntary participation in counseling, showing respect for the client, and developing trust. So, effective communication is going to be another way of undertaking that quality assessment and managing the drug related problems. Effective communication is going to involve developing rapport and a sense of trust. So, for example, nonverbal cues like your body position, your facial expressions, and any other gestures are going to have meaning and influence in the way your communication is interpreted. So, sitting at a large distance from your client might make them feel safe, but it also might make them feel that you don't want to have close contact with them. If you speak their language by using words that they usually use, your client's going to feel a little more comfortable because they feel like you understand them. You need to attend to the person's immediate concerns. So your client might express some various needs and request your support. And it's going to be important to listen to them and help them feel that they're being listened to. Make an effort to really understand what their immediate needs are and address them first. Be honest with them and tell them, you may need more time to understand and work with them on ways to address some of their needs. We want to show concern about their drug use problems without prejudice. We want to use appropriate language to overcome potential communication barriers. And again, language can be verbal or nonverbal, so be aware of your body language. Your communication style is also going to be very important. When you're engaged, your eyes should be warm and inviting. They should show you're interested in what they have to say. Try not to be closed off. Don't cross your arms or your legs. Sit in an open manner. Don't slouch. Kind of lean forward a little bit. Let the other person know that you are listening. So, do you understand the difference between empathizing and sympathizing? In drug addiction counseling, we need to know which of the two do you think works best, empathizing or sympathizing? I'd like for you to put your answer in the chat box. Which one works best? A professional counselor understands clearly the difference between empathy and sympathy. So a counselor successfully expresses empathy toward clients by listening and understanding what they're going through. Counselors are not obligated to agree with their clients, but they must not be judgmental in disagreeing. The counselor is going to provide feedback and help the client find their own solutions. Counselors should avoid sympathizing. They should not take sides and they should not get emotionally involved, as that's going to undermine the potential benefits of counseling and it can cause counselor burnout. Empathizing means understanding the circumstances, the situation, and what's happening to the client. It does not mean sharing those emotions. In empathizing, one is objective and compassionate without being overly emotionally involved. Sympathizing is agreeing with the person, feeling their emotions, and being on their side. So when you sympathize, your client no longer has you as a counselor. They might do just as well talking to themselves in a mirror. You stop being objective and reflective. You're just the same as your clients at this point. In empathizing, you understand what the person has gone through, their suffering, their pain, and their hurt. But when you become sympathetic, you carry their pain and agree wholeheartedly with them, and you lose that ability to be an effective counselor. So, today we discussed that drug addiction counseling is an intervention that gives the client an opportunity to explore his or her drug use confidentially and to discuss available treatments that are most appropriate to their circumstances. Drug addiction counseling encourages and motivates clients to reduce their drug use related risks, and it supports them to seek care and support. Communication is going to play an important role in counseling in general and in drug addiction counseling in particular. And lastly, we discussed that counselors should be empathetic, not sympathetic. Thank you for participating in this second lesson. If you have any questions, please put them in the discussion section for this particular lesson. If you have any questions about other material that's covered in other units, please put your questions for those lessons in that unit's discussion board.